Good evening, everyone. We are letting people in as fast as we can. Welcome this evening. Let me see if I can get a few more folks in and then we will get things underway. I hope everyone is doing well on this lovely day here in the DC area. Although we kind of jumped to summer a little fast. So I'm hoping things will cool down a little bit. All right. Wonderful. We got a good group to start with, and I know more people will come in. So, welcome everyone to our monthly Arts, Health, and Research Masterclass for Encore Creativity for Older Adults. We are so glad that you are here, and we want to make sure that we thank AARP, as always, for sponsoring these monthly masterclasses so that folks can attend them for free or in the pay what you will model. And this evening, we are going to be learning more about music and health and how we can use music to keep our brains healthy as we age. So we are so excited to have Dr. Julene Johnson here with us from the University of California in San Francisco. She's a longtime friend of Encore, and I've had the joy of working with her and being with her in several different areas throughout the last couple of years. And so she is a professor of cognitive neuroscience in the UCSF Division of Geriatrics within the School of Medicine. She also has a music degree, which is what brings her two worlds together in the work that she does. Her undergraduate degree is in music with 25 years of studying music, aging, and dementia all together. Her early studies focused on preserved memory for familiar songs in older adults living with Alzheimer's disease. And in 2010, she was a Fulbright Fellow where she studied the relationship between choir singing and well-being among older adults in Finland. After returning, she continued to focus on developing and testing music-based interventions to promote health and well-being among older adults with and without dementia. She was the principal investigator of the Community of Voices study that tested the effects of community choir on health and well-being of diverse racial and ethnic older adults. And we all know, we talk about a lot how Encore Creativity came out of a creative aging study with Dr. Gene Cohen. So we are right alongside some of these studies. She currently leads the NIH-funded Music and Dementia Research Network and is co-principal investigator for the National Science Foundation-funded AccelNet for Music, Movement, and Brain. She also leads the Meredith Willson Pilot Research Program for Music and Health Research, which awards pilot grants for music and health research across the lifespan, and we'll be applying for one of those very soon. So we are so excited to have her with us this evening or afternoon where she is out in California. And we invite you to participate. Please feel free as she's talking. If you have a question come up, please feel free to put them in the chat. We'll pause periodically for question and answer. And we're just excited to have you with us here, Julene. And I think I accidentally muted you, so you'll need to unmute again.
Thank you so much, Marianne. It's really wonderful to see so many faces here. And I, again, like Marianne said, have been fortunate to be interacting with the Engaged Creativity for Older Adults for many years, and Marianne also. And I've been to some rehearsals in person when I've been in the DC area. That we had several folks collaborate with us a couple years ago at the AARP headquarters in Washington, D.C. So I follow you very closely, and I'm impressed with all that you do and the concerts and the programs and the education that you put on. So I'm in awe of the program and what you all are doing, and you're growing and expanding to the West Coast, and I think that's just absolutely terrific. So I'm really happy to be here. And as Marianne said, I'm very happy to take questions either during the talk. I have some slides, of course, or at the end, and it's up to you all. I have a hard time monitoring chat, so Marianne said that she will help with that. But please don't be shy. I love questions, especially from the folks who are our colleagues in research, which are all of you. And I will get started unless anybody has any questions. But thanks, Marianne, for the wonderful introduction. And let me just get my slides up and working. Okay, can you see that?
Yes.
Okay, let me just. All right, so the title of my talk today is The Benefits of Music for Aging Adults and Brain Health. And I'm all there in there with you with the aging adult aspect. And as you know, all of us are aging, and we have an interest in thinking about how music might benefit brain health. And I define that broadly. I also mean body health too. So brain and body, broadly speaking. And I like to start out many of my talks with this slide here. And this is a quote from Rhodessa Jones, who's a local theater artist here in the Bay Area. And she uses playwriting, acting, and directing to empower incarcerated women living with HIV. And she began her work in prisons back in 1989 when she was hired to teach aerobics in the San Francisco County Jail. But she quickly realized that she could have more impact if she used the arts and music. And so I resonate with her quotation. Art for art's sake is fine, but I don't have the time for just that. I think art should save lives on some level, and it's about moving us all forward. So I recommend you check out Rhodessa's work. She just does an amazing work with using the arts for health. So during my career, and I've been researching music and health in people living with and without dementia all of my career. It's been over 30 years. It's been wonderful. But during my career, I've asked a very simple question. Can engaging in music promote health and well-being among older adults? And if so, what is the potential of music? And I've jotted down some ideas and kind of how I've thought about engaging in music and health over the years. But I would love your thoughts at the end to think if there's other aspects about how music can promote health. So I think a top benefit that we've researched for many years now is music has the potential to improve well-being. And by this, I mean broadly both quality of life, vitality, joy, etc. And also the well-being of communities, not just individuals, but well-being of communities. I'll talk a little bit today about how music helps with brain health and what's special about music in that context. Another aspect is, especially with choirs, is engaging with your community. And not only are you meeting in your community settings, but you're also giving back to community, which is very important in life to have purpose and meaning. But you're also building community by singing in choirs and sharing your beautiful music. There's also an aspect of lifelong learning that make music is incredibly fun to do, and you can do it from the very beginning of life all the way up to the very end. So it's accessible. It is an opportunity to to engage your brain and body and learn something new and that's interesting over time. I'll talk a little bit about how engaging in music can also delay cognitive and physical decline, which of course are top on my list of things that are important in life. And of course, in the event of somebody develops and lives with a chronic illness, music also has potential to help with the management of that chronic illness, whether it's for pain or anxiety, depression, physical disabilities, etc. And this is just a short list, and I would love to hear if you all have any other things we could put on this list. I know it could be longer. So I think of music as being uniquely special for this kind of conceptual reason here that I have on the slide. It's because it particularly engages multiple mind and body systems. And the main ones that I'll focus on today are cognition or thinking abilities, affective systems, which are more emotions, and then the motor system. And all of these systems work together when you're engaging in music, whether you're listening to music or creating music or sharing music with the community. And of course, we experience all of the music through our sensory systems. Auditory system is the top one, of course, but also our visual system and proprioception, our feeling, and understanding where we are in space and time, etc. So I think it's one of those activities that has incredibly deep and meaningful aspects to it, which make it fun to do. It makes it engaging, but it also promotes health and can actually help you stay healthy. So I would be remiss if I didn't mention that we have been interested in brain and music for a long time. And here is an example of a 19th century model of how they thought about music in the brain. So Adolf Kussmaul here in 1877 speculated about how the brain processes music. But what he did was this is his language model here with all of the different lines. And with the idea center up in the J, and you have your auditory system, which is this line over here to your left, which goes to the idea center. But that's for language. But this arrow that I have here is pointing to a line which specifies that he didn't know what was happening with music, and that's for the perception of music. He didn't connect it to any other part of the brain in his language model here. But I think this is an example of an early speculation about what is it about music and brain. And we've been thinking about this for a long time. And I have published in this area a fair bit and really have fun with thinking about the historical roots of music and brain. So this schematic here is a little bit of an oversimplification, but it shows, I think, the main points I want to make here is that music is processed by multiple areas of the brain, but also that different aspects of music are processed in different parts of your brain. So for example, you can see here in red and orange up on top here, these are the parts of the brain that process pitch information. So if you just look over here, we've got some red dots over here, and some orange dots, and as you can see, this is predominantly a right hemisphere processing of pitch. And you can see in the bottom, the R stands for the right, and in the bottom, this left side over here on the left. But if we contrast that with areas, for example, that are involved more in recognizing music, which are the brown areas or the pink areas for emotion, those are in different parts of the brain and involve both left and right and front and back parts of the brain. So as I mentioned, this is an oversimplified view of how music engages multiple aspects of the brain, but it shows you the degree to which music can activate different parts of the brain. When you think about music, it's just not a right-sided aspect or a kind of frontal aspect of the brain or the temporal lobes, which is near where your ears are, but it engages lots of aspects of your brain. And this is one of the reasons I think why music can be so good for your brain. It's just it deeply activates your brain depending on what you're doing. But of course, this engaging with the brain doesn't happen in little spots in your brain. It actually occurs in networks and large scale networks that connect different parts of the brain. So in this schematic here, you can see that these networks underlying the responses to music include multiple pathways and also networks, whether you're doing music-induced motor, for example, for the auditory motor pathway, or perhaps you're doing, oh, I see a typo here, auditory limbic, which is more of your emotional systems get engaging, etc. So it's not just that certain parts of your brain are engaging, but these networks are engaging with each other and talking to each other, which I think is also important for the benefit for your brain and body. And if we think specifically about what are those candidate brain networks for the benefits of music, and I think about these in the context of aging and people living with a neurodegenerative disease, such as Alzheimer's disease. And as you might imagine, with the connections between your auditory system and your ears and your memory, that music can evoke autobiographical memories. We call them memes for short. Music evoked autobiographical memories, but also how familiar that music is to you engages the memory and auditory systems in that network. But as you know, music can also be incredibly rewarding and moving. And so the emotions that come from listening to a song or singing a song, both positive and negative emotions, and also pleasure, they can induce pleasure. And that auditory reward system in the brain gets activated very heavily. And I'll talk a little bit more and have some examples of that. And of course, many of us have experienced how music moves us. And most, if not all of us, knows what music makes us happy or perhaps sad. So there's a lot of emotion that is evoked when listening or engaging in music. But music can also be connected with your attention systems, whether you're predicting what's coming next or you're noticing that what you're singing or what you're listening to or might be new versus something that's old. And these expectations and novelty also are food for the brain when you're listening to music. And this other network that between the auditory system and the motor system, and I'll talk a little bit about the groove, this kind of spontaneous um, interest in spontaneous movement that you sometimes have when you're listening or creating music. And it's often very easy to do and it feels good. So these are these four candidate networks that we think are really important. And then, of course, you have other things like creativity and sense you have to integrate your senses and you have to synchronize behaviors between yourself and others, and all of that's very complex too. And it all happens at precise milliseconds, right? We all have to coordinate that together for it to be artistic. So Anne Blood and Robert Satori, who are two researchers at McGill University, used positron emission tomography, a type of brain imaging, to study brain mechanisms underlying intensely pleasant emotional responses to music. And they asked participants to listen to music that reliably produced chills. And I'm sure you all have experienced that. These are the feeling that you get where your skin and your hair and your arms kind of stands up. And as the intensity of these chills increased, brain blood flow actually increased and decreased in brain regions thought to be involved in, again, this reward and motivation, emotion and arousal. And up on the top, you can see those areas that are in the different colors are activating areas in the midbrain, whether they're including the ventral striatum, the amygdala, etc. And on the bottom here, you can see areas that are being activated in what we call the orbital frontal cortex, or that middle part of the frontal cortex. And again, these are some of the areas involved in emotion and attention and reaction to music. So this is an example of using intensely pleasurable responses in the form of chills and how your brain might react to that. It's just remarkable when you think about it. But in particular, familiar music can facilitate access to meaningful memories. And we've all had this experience when a family member or friend says, "Remember when we visited so and so and we all sang the such and such song together?" Or "Remember when we were in high school and we all went to the X concert together?" And that in that way, music that's familiar and meaningful has this kind of super highway into your memory systems. And every time or many times that you listen to that music, it will remind you of those events and times and feelings across the lifespan. It can be from when you were younger or older, or etc. And not surprisingly, music exists in all cultures, and it often brings people together. So it facilitates communication and induces these kind of shared emotional reactions, such as at a wedding. It supports the development and preservation of identity, such as singing with an older person in an intergenerational setting. And there's also many examples of the therapeutic use of music, such as in music therapy, that have been long recognized. And as you can see, many of these events that mark our lives, like graduation, weddings, funerals, um, 4th of July activities, all of these often have music alongside them. And there's a reason for that. It's because our music exists in a culture. And it's one of the reasons why those autobiographical memories just come back so quickly, is because it has this extra layer to it that's meaningful. And so, how do we actually recognize tunes as being familiar? It's really interesting. Um, we retain extremely precise knowledge about familiar tunes, and down to not only the rhythms and the pitches and the even the tempo, or the intensity of the volume, about how loud or soft it is. And all of that is automatic, that you remember that information, and it's automatic. And then on average, you can of the on average, about 30% of the songs that you know evoke some sort of autobiographical memory. So if you think about your whole song list that you have of all of your life, which is probably hundreds, if not thousands, of songs or melodies or pieces, about 30% of those have some memory that's attached to that piece of music, whether it's a small memory or it's something more deep and meaningful. But that's really remarkable. And it just shows you to the degree to which that music can be involved in this coupling of memory and music. And as I mentioned, we have these extra musical references such as autobiographical memories. And then we also get hints from in songs with the content of the lyrics. We know whether it's a march song or a love song, etc. And the genre also helps us. We have many holiday songs or patriotic songs that we, tap into with every kind of celebration that we're doing. And as I mentioned, that we have these emotional associations too. So if you went to your graduation, you can potentially still remember your reaction to hearing the music played at your graduation. And it's often effortless and automatic. So we don't have to spend a lot of time conjuring up those feelings and conjuring up those memories. It's just something that's really quick. So I think that's another aspect of music that makes it really special. So some brain areas, so some parts of the brain, turns out, are more likely to be activated when you're listening to familiar music compared to unfamiliar music. So again, when I showed you that first schematic showing that the brain processes different aspects of music, but it also thinks about familiarity and whether you're listening to a familiar tune or an unfamiliar tune. And you can see here in the three biggest clusters that were observed that are more activated when listening to familiar music in the A column here is more of the superior frontal gyrus. And these yellow dots here are representing increased activation when you're listening to a familiar music compared to unfamiliar. And it occurs kind of in the midline here in the superior frontal gyrus. But this is kind of from the top of the brain on the left side, and this is looking through a cross-sectional section looking this way, and the bottom one here is looking at it from the side. And so you can see exactly where that kind of superior frontal gyrus is. And then in the more thallus, which is in a deeper part of the brain here, this is more associated with emotions. In this B column, you can see the areas that are activated again to familiar music compared to unfamiliar music, probably associated with those emotions. And finally, the third cluster occurs in the C section here, which is what we call the medial surface of the superior frontal gyrus. So the take home is we have more changes or differences on the cortex or the outer side of the brain, but also deep inside the brain such as the thalamus here. So not only just the aspects of the music, but when you compare familiarity, it's your brain listens differently. So music, as I mentioned, music can evoke emotions. And this ability to perceive the emotional aspects of music actually begins early in childhood. And it also develops throughout life. So, as I mentioned earlier, this aspect of lifelong learning, you can continue to hone in your skills of understanding emotions in music. And it doesn't just stop when you're in your 20s or 30s. But as you become a more seasoned singer or a connoisseur of music, you can continue to develop the ability to perceive those emotional aspects of music and build them into your listening kind of display or your performance for that matter. And as I mentioned earlier, music is often present during events that have emotional meaning, and these are the ones that get linked. So this is where emotions interact with meaning and memory again. And then, as I mentioned, music is this powerful cue to facilitate the recall of these autobiographical memories and also nostalgia. And there's not a ton of things in life that kind of evoke nostalgia, but music is one of those that seems to be very effective in having that emotion. And this is sometimes can have an edge to it. Sometimes it can be happy. It could also be somewhat of a sad. If you're nostalgic about missing something, you can have this kind of special emotion. So I return to this slide that I showed you earlier, again, to show you that when you're having these intensely pleasurable responses to music, that these are the reward centers of your brain that are being activated. So you can see again that these are happening in the orbital frontal, which is more on the cortical side, and deep inside in the midbrain. So again, kind of more superficial parts of your brain, but also deep, which is important. And here's a different study by Sarah Hennessy and colleagues who found that nostalgia that is evoked specifically by music activates what we call the default mode network, which is this part of the brain that kind of sits back here on top of your head over here. And in addition to this default mode network, which by the way happens to be affected pretty early in people with a neurodegenerative disease. So it starts to be affected. It's one of the early parts of the brain. But in addition to music that evokes nostalgia activating this default mode network, it also, once again, activates the reward network, such as the insula, and across the lifespan. So they did a study in younger people and older people. And what was interesting is they found that older adults had a stronger brain response than young adults in this nostalgia-related regions of the brain when listening to nostalgic music. So again, this idea that you can continue to grow and build your responses to music across the lifespan. And not surprisingly, we use these phrases often to kind of capture some of this intangible aspects of what music does to us. We say, music touches the soul, or music moves me, or music is what feelings sound like. So we have sometimes have a hard time putting into words what music does to us, which makes it doubly challenging when you're a researcher trying to figure out how to study this. But these are some phrases that I think capture some of the essence of how music makes us feel. And of course, if we think back to that schematic that I showed you in the beginning, cognition or thinking abilities, emotions, and movement, I'll think a little bit here about what is it about music and movement and how they get coupled. Well, we already know that in the context of dance, music and movement are really strongly coupled. But if you just watch anybody react to music, we have lots of body movements, whether you're tapping your foot or swaying back and forth or clapping your hands or bobbing your head. It's very easy to move to music. And when we start to bring in those emotional systems with the movement and the music, we get into what we call rhythm or groove or flow is another word that some people use in that kind of experience. And this experience of getting into the groove, which we've all done, if you've done anything with music, is it's this automatic urge to move in response to music. And this is where those motor and sensory systems once again combine and they're synergistic, and that being in the groove feels good. So there's that combination again of systems that are synchronizing, but in the experience of it oftentimes is feeling good. And it's a lot easier to move to music, for example, than just randomly moving around, especially when you're trying to do something that's rhythmic, for example. And here we are with the schematic again. Again, I'm making the argument that this is one of the reasons why music can be so effective for your health, because you're not just using your ears or your auditory system, you're not just moving, you're not just using your voice, but you're really integrating all of these systems in ways that often don't get integrated with other experiences in life. Okay, now I'm going to shift a little bit. And now I've kind of gone through and talked about the brain mechanisms of music, why music is effective for engaging the brain and your body and your thinking abilities. Now I want to think more about is engaging in music, can it help reduce the risk of developing cognitive impairment in dementia? And what is the evidence for that? So this is a study that
Excuse me.
summarized, yes.
There were several questions in the chat. Before you move on, could you
Okay.
go through those?
Yeah, Marianne can read them. Absolutely.
Sure. Um, there was a question about, does synesthesia impact singing?
Oh, that's a great question. I have to say, I do not know. I do not know the answer to that. That's a great question.
And then the other one, have you studied singing in a language other than one's native language?
Yes, I'm going to talk about the Community of Voices study in just a few minutes. And I will talk about the different languages that the research participants sang in that study. Some of them were learning to sing in a new language, not completely for the study, but it was part of their choir. They were multicultural.
Okay, those are the questions we have so far.
Terrific. Thank you for interrupting me. Okay, so back to now shifting to think about Does engaging in music decrease one's risk of developing cognitive impairment or dementia? So here are two studies by this is a studies that highlighted two studies by Hughes and Verghese. And what you're looking for here is that the one line here suggests that there's no difference between increased risk or decreased risk. So what you want to see is that the lines here with the center black dot are below the 1. And so you can see in the Verghese study in 2003 found that there was a decreased risk of developing dementia when the individuals played a musical instrument. The Hughes study in 2010 was less clear. The error bar was larger, but the trend was still as a decreased risk. But those are two early studies that came out. And then there was another scoping review now with 11 studies that had a slightly different strategy. They were comparing musicians and non-musicians. And what they found were, all of these are older adults, they found that musicians generally performed better on cognitive tests of memory and attention and executive function, and that they were more accurate and faster than the non-musicians or the older adults who didn't study music. However, non-musicians who played an instrument in later life, so in other words, they took up a musical instrument later in life, had better scores than those who did not play at all in later life. And what they found were that these, non-musicians that took music lessons, so amateurs, in other words, had improvements on cognitive tests such as executive function compared to those that didn't. So this was across 11 different studies. So this evidence was also suggesting that whether you are a lifelong musician and have engaged in music training all of your life, you're doing better than somebody who hasn't. But also if you take up music later in life, you are still getting some benefit to training. And I'll talk a little bit about, we have a music training study that we're just finishing up here at UCSF. So that's good news. And then this is a study that just recently came out of Australia. It was the Esprit study, and they engaged with almost 11,000 community dwelling adults age 70 plus.
Completely lost my audio.
Sorry about that. Can you hear me now?
No.
Is there anybody else having problems with audio?
I'm not.
Okay.
No, please continue.
Okay, well, we're recording this, so you'll be able to go back and listen to the part where your audio dropped. Sorry about that. So in Australia, they did surveys with almost 11,000 older adults and asked them about their behavior about listening to music often or always versus playing a musical instrument sometimes, or always or often, and then doing both, listening and playing a musical instrument, often or always. And you can go to the paper to see how they defined always. Obviously, we can't listen to music all day and play a musical instrument all day. So they had operational definitions. But what they found was that always listening to music, which was meant they were listening to music a lot, was associated with the greatest reduction in dementia risk, meaning that the older adults who always listened to music had a 39% lower incidence of dementia. And there's that one line again where you want to see your bars going below that and not crossing it. So that first arrow shows listening to music has a 39% decreased risk of developing dementia. And then the next arrow here shows that playing a musical instrument often or always has a 35% decreased risk of developing dementia. And then finally, the last arrow on the bottom, both listening to music and playing a musical instrument also had a 35% decreased risk of developing dementia. And this was often or always. So there seems to be something about the frequency of engaging in music that can help decrease the risk of developing dementia. So more frequent seems to be better than less frequent. And then the other studies were suggesting that training in music versus not training in music, that's important too, those differences. Okay, so those are a few of the studies that have looked at, can engaging in music decrease your risk of dementia? And the answer generally is yes. There's some caveats with that I've talked about, but I think that's something to put in your back pocket as you're singing in choirs, that you're probably working on decreasing your risk of dementia in addition to enjoying singing. So I'm going to shift a little bit now to, unless somebody has any questions about I'm happy to answer questions at the end also. Any burning questions? Okay, so now I'm going to shift and tell you a little bit about the research that I've been doing that is relevant to what you all are doing in the Encore Creativity programs. So I asked, this was after I got back from Finland, doing my Fulbright in Finland, where I was studying the relationship between singing and well-being in older adults who were living in Finland. And I came back to San Francisco and I wanted to better understand if singing in a choir as an older adult has any health benefits. And the majority of studies up to that point had been more observational studies. So they didn't randomize people to a choir versus an active control, or in the case of the Community of Voices study, we randomized the senior centers to start their choir immediately versus wait 6 months. And I was fortunate to receive a grant from the National Institute on Aging to do this study, and it took place over 5 years. And this study, the Community Voices study, was based on the study that you all did originally with the Encore choirs. So that study did not use randomization for their control group and their choir group, but I was very, very dependent on the Gene Kelly study that was and Cohen study that were the first choir study. You all in the Encore Creativity were part of that. So this was building on the findings from that and adding randomization to this. So it was a partnership between the university at UCSF, our city and county aging services, and a local community music center. And we formed this partnership to be able to enroll almost 400 individuals into this cluster. We call it cluster randomized because they were randomized by site, not individuals. And we had 12 different choirs that we started, and half of the choirs started their choir immediately. And then the other half, the other 6 choirs, waited 6 months and then started their choirs. So that was the randomization where we compared after 6 months, those who started their choir immediately after doing their assessments compared to those who waited 6 months to start their choir. And you can see here that the average age was about 70, but it ranged from 60 to 93. Similar to other studies of choirs in the United States, 3/4 were women. We were able to enroll a majority, about 75% folks who were non-white. So it was very diverse, and we tapped into the various neighborhoods in San Francisco. And the previous question was, did I ever do a study where we were singing in different languages? So It turns out that some of the choirs were singing in only Spanish, and we had people that joined those choirs who didn't know Spanish well. We had other choirs that were singing in Tagalog, and two or three of the choirs were very multicultural. So they were learning songs in Chinese, Spanish, and in English. And so, yes, they were learning some new songs in different languages, but it was not only to learn to sing in a different language. It was just kind of mixed in there. And we did engage with choir directors from the local communities and also the musician accompanists who were with them. And you can see here we enrolled folks that were not just all healthy. About a quarter reported that their health was poor to fair. And as you know, with music, it's also very accessible in the sense that you can engage with people with various levels of whether it's cognitive impairment or, physical limitations. And importantly, over half of the people who enrolled in the Community Voices study, which was done in either English or Spanish for the outcomes, over half of them had never sung in a choir as an older adult. So we also did not just enroll folks that had experience singing. So that was important. And what did we find? Well, we found that older adults who sang in the choir for 6 months had significantly reduced feelings of loneliness and significantly increased interest in life. And by interest in life, we mean this is kind of your purpose in the morning when you get up, you're like, oh, I'm going to go to the choir rehearsal today, and this gives me purpose and interest in life. But interestingly, there were no group differences over time in physical function. So both groups had the same walking speed, balance, and strength, and we did not see any differences between the groups on cognitive function. And we also looked whether or not there were differences in healthcare costs. And although the control group, meaning the group that waited 6 months, their healthcare costs nearly tripled, but the difference between those who started the choirs and those who waited was not statistically significant. So if anybody's interested, we have multiple publications on the cov.ucsf.edu website. They're all open access. You can read more about them. Here's some pictures of some of the choirs that we did. And we collaborated extensively with our community partners. And if anybody wants to hear an update about how those 12 choirs that were in that original study continued to sing, you can look up this Cross Currents NPR show, which you all should have access to the slides or whatever you need to get these resources. And how exciting that you all now have another publication in the literature, and congratulations to Marianne and Sandra Quinn, et cetera. And I'm sure you all have heard the results of that study, but congratulations. It's really an amazing accomplishment to have this documented. And as I mentioned, I'm just finishing up a study on music training where we enrolled 220 adults age 60 and over, where we randomized them individually this time to either a music listening training 12-week program or a piano improvisation training 12-week program. And both of the groups got equipment. So the group that did music listening training got a tablet, and they learned how to use YouTube and some other tools to select music that the small groups were listening to. And the piano improvisation training group had a piano delivered to their home, an electronic keyboard, and both groups practiced at home. So we're just finishing up that study. So stay tuned for that. And then this is another project that Marianne mentioned I'm working on right now. I'm leading the Music and Dementia Research Network, where we're bringing together experts in music and mobile technologies. And Pepe Contreras-Vidal is at the University of Houston, and he is our bioengineer. Melita Belgrave is our music therapy researcher in aging. And then Jing Chang and I are here at UCSF. And we're building out this network with different pilot studies and specifically interested in mechanisms, and it's funded by the National Institute on Aging. And you probably all heard about the AARP Music, Dementia, and Brain Health Research Summit. And this is where Engage Creativity had several folks that participated in our public day. And there's a video, a full-length video of that, and you're welcome to watch that. It's really fun. And again, thank you, Marianne, for your collaboration on that. It was really fun. We had a blast. And, music has been a promising non-pharmacologic approach for dementia for many years, but we just don't yet understand the mechanisms by which this happens. And if any of you are familiar, this Alive Inside documentary came out about 10 years ago and has many, many millions of views and people who've watched it and helped change the landscape for thinking about music can be beneficial for people living with dementia. And I'm not going to go through this, but I want to alert you to, since you collaborate with AARP, that in collaboration with AARP, we developed the Music for the Dementia Journey, which is essentially, we strongly advocate for including music at every step of a dementia journey for families and communities, starting with the home, thinking about how the community can be more welcoming. And I know you have some choirs that focus in community settings, assisted living, whether somebody's in a nursing home, even in a hospital stay, you can bring your music with you. And of course, more at the later stages and end of life or hospice care. I'm not going to go through this for this talk, but it's a tool if you have family members or friends that have a loved one or a neighbor who is going through a dementia journey. Please share this infographic. It's free to download, and let's get the word out. And I wanted to also share with you, I help mentor a high school student who received a wonderful Young Founders Program Award and he's developing a resource book for teen musicians in high school who want to offer music to older adults living in memory care. And he will have that published soon, and look forward to thinking about the intergenerational prospects of music and harnessing the younger generation to help, improve quality of life with music. And then if you want to attend any of our webinars on our Music and Dementia Research Network, feel free to tune in. They're all free, and they all are also recorded. So you can either watch them live or asynchronously. And they deal with different questions about mechanisms in music. And in this case, here's Sarah Hennessy on the right, who did that article about nostalgia in music, and she's going to be talking about personalizing the stimuli. And we're going to be up in Chicago and working with Northwestern University in July and thinking about, we'll have a workshop with mobile brain technologies where we use mobile EEGs and music therapists and other health professionals to study the benefits of music. So I'm going to stop there and open it up for questions. It's been really great presenting my thoughts with you today.
Thank you, Julene. We have a couple in the chat. Jan says, so playing multiple instruments and singing, studying music theory are all good things?
Yes. Yes. Yeah, and it's interesting you brought in the concept of music theory too, because that's very intellectual, right?
Mm-hmm.
So I think that's another aspect that we often don't think about in the sense of what else can you do besides go to concerts, perform, learn new music, whether it's a musical instrument or singing, but also learn about music theory and maybe perhaps even music history, right?
Mm-hmm. Absolutely. And then Diane asked, are there differences in benefits between singing and playing instruments?
That is a great question. It's $1 million question. We have not, meaning the royal we, the research community, has not asked that question yet. We are still trying to better understand individually what is it about choir singing? What is it about musical instrument training And my hope in the future is that we will be able to better personalize recommendations for perhaps what music engagement encounters you want to do. For example, based on a lot of the studies on choirs, we know that singing in a choir seems to have a strong effect on emotional well-being and loneliness, right? We have, in a randomized trial, we can say that it can reduce feelings of loneliness. So if you go to your doctor and say, I'm having experiences of feeling lonely and I feel isolated, your doctor potentially can prescribe to you, why don't you go to a choir?
Mm-hmm.
Versus somebody who comes into the doctor's office and said, I'm a little worried about my memory, and is there anything I can do for my memory? Well, it seems that, again, we haven't compared them back to back yet. We have to do that learning a musical instrument or learning something new with music might be beneficial for improving your memory or your thinking abilities.
Mm-hmm.
So you can start to see that. I think that's the next frontier, is saying, if I'm more interested in building a social network and decreasing loneliness, I might, focus on a choir. Versus if you're more interested in your life of, improving your memory or your attention skills, you might say, I'm going to take, some music lessons in something or singing lessons. But we're not there yet. That's a great question. I wish I had the answer to that, but that's where we're headed, I think.
Yep. And then Shelley added, what about dancing too?
Well, there you go.
Yeah, and
Yes.
we had last month we did a dancing and movement for brain health
Mm-hmm.
session. But again,
Mm-hmm.
I don't know as we've ever really like made a little spreadsheet of what benefits come with what, and that would be very very informative because we know that all of them are
Mm-hmm.
beneficial, but to really kind of compare and contrast would
Mm-hmm.
be interesting.
And I'll just add to that, Marianne, one of the things we did in our Community of Voices choir program, and the manual, although we just switched to a new server, so our PDF isn't up there yet, but we really had the choir directors had 3 engagement models where they had to be physically engaging,
Mm,
cognitively engaging, and social emotionally engaging.
mm,
So we built in the Community of Voices study physical exercises as part of that choir, which I'm sure you all do, but it was very deliberate and
mhm.
intentional. And if you go to the website in a couple of weeks, that manual for free download will be up again. It got broken with the switching.
Yes.
Switching, we had to go to a different version of Drupal or whatever it was. It wouldn't allow us to have the PDFs up. But great question. I think that's our future also, but there's nothing wrong with it, putting movement and socialization intentionally into the choir rehearsals, which I know you already do.
Hmm.
So if there's nothing wrong with calling that out, and your choir directors aren't bugging you with that. They're doing it for a reason.
Sheila shared during the pandemic, Encore had many online classes in music theory and music history. I learned so much, and the classes gave me a schedule, which was really a blessing since I live alone. Yes.
Mhm,
Yeah.
mhm,
Um, and
mhm,
currently, we still have those classes going. We don't do as many as we did during the pandemic.
mhm.
But right now, we have a women composer class. Uh, we're doing a Tai Chi class for some movement because folks asked for some movement, and as well as a history of opera.
Oh, nice.
Yeah, so we try to use that as kind of that fleshing out. We've had music theory in the past,
Hmm.
and so that's something that make a comeback in the future. And Shelley shared, I have been and now that I have moved, want to start an outreach group where we go to nursing homes and perform singing,
Hmm.
dancing with them, and any lists of what songs are memories for different ages is the question.
Mm. Yes, that's a really good question. I often think about selecting and talking with folks, or even talking with the assisted living staff, and if there's families that they might know what the general ages and cultural background are of the residents. And a good place to start is music kind of early adult life. So
Mhm.
from teenage to early, so maybe into the 20s. You can start with that time period and then start tailoring it and look for reactions. If people are reacting to it, great. If they're standing up and singing and moving, that's great. You're going down the right direction. If not, if you're not getting much reaction, and interestingly, Armand is doing that same kind of thinking for his teen musicians from high school. So how do they go and interact? So that guidebook, may be able to help.
Yeah.
With that idea. But yes, it's being curious, talking to the staff ahead of time. Maybe there's some sort of a form you can use to help make that easier to do.
Yes, we've talked and we've had several people. Dan Cohen has done presentations for us as well,
Mm-hmm.
and
Mm-hmm.
talking about that idea of the personalization
What's
of
it on?
Yes.
music, right? The more personal it is, the more
Mm-hmm.
engaged folks are going to be in
Mm-hmm.
that music. And so, yes, really talking to the folks that work there, and even talking to the people that you're going to be
Yes.
around, have
Mm-hmm.
that conversation. What were your favorite bands? What did you listen to when you were younger?
Mm-hmm.
Those are great conversations to have as well.
Exactly. And it can be part of the encounter that you do. The music encounter is talking about some of the songs and some of the experiences that people had.
Hmm.
Mm-hmm.
Let's see. Scrolling. Were you surprised that there were no cognitive differences in your study?
Yeah, we were surprised. We were also surprised that we didn't show any changes in physical function. But when we started thinking about it, it's possible, number one, that 6 months is not long enough to really see an effect on cognition for singing. Maybe 12 weeks to 16 weeks is enough for a music instrument training, but maybe not
I
for
don't know why I can't
singing.
get sound.
Um, It also may be that the sweet sauce for the choir is really in the more psychosocial aspects, emotional, psychosocial, and we perhaps needed better outcome measures. We were using pretty standard cognitive measures and pretty standard physical function measures.
Mm.
Yeah, we were surprised. We thought, and then we did qualitative interviews. And if you go to the Community of Voices website, which I put in the chat, and go to the research section, you can read the perceived benefits of the choir as one of the, it's in a publication, sorry, it's in publications. And you can read about the perceived cognitive benefits. So, we're not always great at measuring what people think is happening to them, and that's you're humbled as a researcher, right? And when we realize that, which is why we do mixed methods, we did focus groups and interviews, and feel free to read about those. I think it's there, but it may not be, the signal may not be as strong as it is with the decreasing loneliness and increasing the interest in life. But
Mhm.
great questions. Mm-hmm.
Let's see. Mike shares, I'm in an Irish group and we performed at an assisted living facility and passed out some word sheets for a few popular songs to encourage sing-alongs.
Great idea.
Yeah.
There's some pretty standard ones out there. I think if you just Google it, also. And the Billboard Top Hits is another great place to, as a resource to look. It's online, and you can like Google what were the most, popular songs during the 1940s or during the 1930s or whatever that age range are, and start there. And then, yeah, that's a great idea. And then the lyric sheets with maybe, 14 font, so big font, big letters, so that anybody who might have any visual challenges can use those too, and keep it simple.
Hmm.
Um, that was the other thing we've learned. But yeah, absolutely. Terrific you're doing the sing-alongs.
Yeah. My a colleague of mine who's a music therapist, at the end of the year, Spotify does the what's your age for what
Mm-hmm.
you listen to, and her age is like 80 something because that's what she's playing at
Love
home
it.
at her job. And she's like, "Yep, that's what I know. I know more Frank Sinatra than I know popular music."
Oh, I love it. Oh, that's really wonderful. Yeah. Yeah. Well, our music listening training actually took eras. We did 5-year
Mm.
intervals and they learned about jazz in the context of listening. And that was really fun. That was our music listening training study that we compared it to our piano improvisation training um, classes. So we'll find out what are the differences between the groups and the different types of training.
Yeah. That's all I see in the chat. Do other folks have questions? Feel free to unmute and ask.
One little
I,
question just crossed my mind. With all these wonderful studies and the diversity and target beneficiaries, are you finding much of a difference, reduction in willingness to fund during these economic
Mm.
challenge times?
can I have a follow-up question? Fund from a research perspective or from a community perspective?
Oh, however you'd like to answer. I'm
Well,
just curious, is the money running out? Because the enthusiasm and our numbers and ages are rising. And it just dawned on me. Where
yeah.
do we go to pinch more people about the necessity for this, even if it's not in our own individual wallets? But
Mhm.
just presented it with such enthusiasm, and we're seeing it in the real world as well. Um, or are you finding that you're getting a good audience to hear you, see the beneficial research, which is just marvelous? I applaud you all. I didn't know if you'd seen an impact recently.
I my sense is in the community, I'll start with first, that yes, I think people are starting to see the benefit. I mean, engage creativity is one example. You all are expanding out to the West Coast. So that model is really popular. There's another popular choir model for people living with dementia that is out of Chicago, or sorry, out of Minnesota. And that has been replicated in different cities. So I think they're now starting to see more and more of these models like engaged creativity replicated, which I think is terrific. So you all have a model, you have like a
Mhm.
toolkit, that you can use, and you can offer these choirs in different communities for different, people from different backgrounds, et cetera, which I think is terrific. I do think the majority of studies in the United States still tend to be predominantly higher income, more white folks than, non-white folks in the studies. But I hope that will continue to change as we start to kind of branch out into different communities, because music is such an easily adaptable intervention and program. Because we in the community voices, they sang in Spanish, they sang in Tagalog. There we had 2 sites in our African American parts of the city, and they were singing songs that were meaningful to them, and the choir directors were from the communities. And I think the community music center has since expanded into other communities with that same model at a smaller scale in San Francisco. um,
Great.
the
Thank you.
research funding is a different story that that will take a little longer to answer. The good news, I had one grant that was terminated. My National Endowment for the Arts grant to run the Sound Health Network was terminated,
Oh,
but they didn't terminate my Music and Dementia Research Network. So I'm, fingers crossed that'll continue to be the case. But it was on apparently it was being considered, but it didn't get chopped. So
great.
yeah, it's a challenge, but you just have to roll with the punches. When I got out with my PhD, there was zero research funding. I mean, zero. And I didn't get any music research funded until I went to Finland on a Fulbright. And that was over 15 years into my career.
Good
So
persistence. Good persistence.
yeah, I've been persisting for a long time. And then for the last 15 years, I've had research funding in music, but I didn't in my first 15 years. So I'm hopeful. I think we as community members, we have to advocate for music, as I mentioned, across the community continuum, right? In the community, all the way into the hospital, into end of life, everything. It should be a part and offered and accessible. So yeah, that was my soapbox a little bit.
I appreciate it. It's great. Just share the info. Very good.
Yeah.
Mike asks, is there any evidence that singing or playing an instrument can reverse or slow the progression of dementia?
That's a great question. So the first one is, can it reverse? And unfortunately, no. There's really nothing that we know of that can reverse dementia at this point. There are some studies that are looking at slowing down the progression, especially keeping folks at an earlier stage for longer. I think some of those studies are in progress. We don't have hard evidence yet, I would say. There's a few small studies suggesting that it can slow down the progression. One of my colleagues at UCSF, she's a geriatrician, but also has a PhD in ethnomusicology. She's looking at the experience of music after getting a diagnosis of a dementia. And it turns out that in her qualitative research, that caregivers or care partners who are super stressed about caring for their loved one or family member or friend with dementia, if they're super stressed, they stop engaging with music. But if you're a care partner who has some background in music, whether it's part of the family or perhaps you had a nursing background where you learned about music, those care partners continue to use music in a positive way in the home, for these caring for people living with dementia. So I think there's a whole other aspect of the experience of dementia. It may not be the most potent thing to slow down the dementia, but we know we can improve quality of life for both the person living with dementia and their care partner, and hopefully their family too, right? So I think that's another aspect that we're thinking about. What are the potential uses? Good question.
And then we have some shared experiences.
Oh,
Francie
good.
shared in New York City, there is a hot club that focuses on listening to music from the 20s through the 40s. Ooh, I want to visit that. The age range of participants is 20 to 90 something. Some are
Wow.
well-known musicians, others are amateurs, but they all engage in active listening.
I love that idea.
That sounds cool.
Yeah.
And then Faye shared, my husband had a stroke in his thalamus during a procedure intended to insert a stent and was severely disabled cognitively and physically. He
I'm
was,
sorry.
however, able to sing along with almost every song written between the 1930s and the 60s.
Oh, that's a wonderful thing to share. I'm sorry to hear about that, but I'm so impressed that you were able to figure out that the singing along was a meaningful experience for your husband. Yeah.
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 Blossom just asked, do you recommend learning a new instrument?
Well, we're just finishing the study. Seeing the benefits. It is a mechanistic study. It's not a broad benefit study, but we know from the literature so far, especially from my colleague Jennifer Bugos, that yes, learning a new musical instrument is good for your thinking abilities, especially executive function. So I would, based on older studies, recommend that. That would be a good thing to try. And it can be, we selected improvisation training in jazz because we didn't want to, you know, require folks to do as much note reading and as much theory and et cetera. So there's accessible ways to learn a musical instrument. Piano is hard,
Mhm.
Something like a ukulele or a guitar could be easier, and certainly drumming, like these drumming circles that are popping up. I think those are wonderful way to learn about a new musical instrument and don't have a huge learning curve in the beginning. So,
Mhm.
yeah, I would recommend it.
Jan shared studying benefits of multi-generational church choirs would be worthwhile. Mm.
Yes, we've talked about that here in San Francisco. You're absolutely right. And not only is music good in the community and in family settings, but this idea of multi-generational is just, I still think it's really untapped yet.
Mhm. Yeah, it's interesting. I mean, Encore is 55 and older. However, with our dementia choirs, we often have a younger care partner come in. We've had
Hmm.
grandchildren come. Can my grandchild come and sing?
Hmm.
Absolutely, right? I'm not going to say no to that. So
Hmm.
we've had a little bit of that kind of come in.
Nice.
And I know I was talking to somebody the other day about this growing trend of preschools and nursing homes and assisted livings
Hmm.
kind of coexisting.
Hmm.
And so I know that that's something that we are not opposed to at all. We
Hmm.
haven't come across quite the right partnership yet. But that would be something to look at. And the other thing that we always say is we don't check anybody's ID at the door when they come sing with us. Um,
Yeah.
we don't have them enter a birth date into the registration form or anything like that. And we're finding that sometimes they have, children that come and visit. Can they come and sit in
Mm.
rehearsal? Absolutely, they can come and sing with you for the day. That it's such a
I'm
small
sorry, I
pond.
can't, I just can't get it.
Hmm. Yes, and I think it's super important for understanding of intergen in between generations and
Mhm.
even sharing music with younger and older generations and being open to learning about that music of the younger generation, I think is important too. And I know, I have a neighbor who's a teenager who lives next door, and I'm like, what are they listening to these days? But many of you might have grandchildren or kids or have neighbors with kids, but I think it's important to be open. And one of the things that I do on Saturday nights is I listen to a National Public Radio local DJ show here called Tangents Radio. It introduces world music, new world music
Mm.
every single Saturday night. And if I can't listen to it live because it's going too late, it's offered online for the next week, streaming.
Hmm.
It's really amazing. I'll pop it in, but that's how I learn about new music because I'm interested in world music. Tangents Radio, it's called. It's really, really amazing. Um, and it's on KALW here in San Francisco.
That's cool. Yeah, often our rocks choirs they don't just do rock music from their eras.
Hmm.
We've done some AC/DC, we've done some Coldplay, and we always say, you might not know this, but I bet your grandkids do, and they can come hear you sing this. To give them a chance to know a little bit about what is popular now and how it might sound a little similar. There might be some similarities from the Beatles and how some of those things are crossing over, but to,
Hmm.
to keep current as well.
Exactly. Yeah.
That's awesome. Are there any other questions out there? I know we're coming to a close, but we still have some time.
I'm impressed with all these wonderful questions and sharing some experiences. Thank you for doing that. And if anybody else has anything else to add to my list about what are the benefits of engaging in music.
Oh, there you go. Jan says all music was once new. Absolutely.
Hmm. Hmm.
Absolutely. All right. Well, thank you so much, Julene, for being with
Thank
us
you
this
all.
evening. I learned a lot and reinforced some things that I had heard before. And we all wish you well on your investigations and seeing the results of your studies. And then knowing how we can use that information in what we do here at Encore. That's really what I'm interested in, is what does that mean for all of us, and how can we use that to benefit our folks here. So thank you so much.
Thank you all. Yes, thank you, Marianne.
Yes, and again, thank you to AARP for sponsoring us in our monthly master classes. Wednesday, if you have not registered, Wednesday we will be with Deanna Saez from Towson to work on her piece Temporal. And you can come either in person or on Zoom, so make sure you register for that. Next month, we're going to be talking to Anne from the Stroke Comeback Center, because next month is Stroke Awareness Month, as well as kicking off our anniversary, our 10th anniversary for our ROCKS program with Jeffrey Dawkins. So we're excited for things coming up. And thank you for staying with us this evening. And again, thank you, Julene. Have a wonderful night.
Bye, everybody.
Bye-bye.